From hospital waiting lists to doctor numbers, health has been one of the election battlegrounds this week. As Kirsten Vaness reports, there are still areas that have missed out on the health funding frenzy.
In the border town of Echuca, there's no bigger issue than the local hospital.
Everybody in the area is concerned about it.
Echuca's sister town of Moama went to the extreme of changing its name to Motown for a month as part of the Movember campaign to raise awareness about men's health.
Do I look as bad as I feel?
The campaign's also got locals thinking about their own health facilities.
It's a bit of a disgrace. I have my mother-in-law there at the moment. She suffered a stroke and, yeah, the facilities are just archaic.
With the first patient treated at the Echuca Hospital in 1882, it's a piece of the town's history.
We have difficulties moving beds from room to room. A lot of the lifting equipment required to help patients bathe don't fit in the showers.
Dr Goodman says it's been nearly 50 years since the hospital received any new beds.
The brown brick building is where 5 of our emergency cubicles are located.
And what are they like? Is it quite old?
Yeah, the building itself is quite old. That's a building that was built in 1882.
Doctors say there are holes in the walls, loose tiles and peeling paint, making hygiene difficult. Most alarming is this, a white ant's nest at the doorway to the hospital kitchen. It was removed just last month.
If there's termites in one part of the hospital, then chances are there are termites through quite a lot of it. So we're not asking for funding that's not required. Our hospital will fall down.
But the town falls into the very safe seat of Rodney, held by the National Party since 1917. The Australian Medical Association says the Echuca Hospital is just one example of ad hoc health funding.
It's really, if you're my friend, I'll give you some money. If you're in a marginal seat, I'll give you something there. I'd like to see a real plan for the future for Victoria.
In Melbourne, as the population grows, it's the suburban hospitals that are feeling the pressure. The AMA says at the Maroondah Hospital in the city's east, admissions have gone up by 25% over the past 3 years.
On top of all that that's been promised already, we need 187 beds per year for the next 10 years just to keep up, just to tread water.
The AMA says it's this lack of beds that's having a direct impact on ambulance response times.
The ambulance arrives, there's no beds available in the emergency department, there's no beds available in the wards. As a result of that, you call an ambulance, there's none available because they're all ramped up waiting to deliver patients. This is a common problem across Victoria.
We've said very much that we need additional paramedics, and we brought forward a significant package, a $151 million package that will deal with a lot of these issues.
We've tripled Ambulance Victoria's budget. We've more than doubled the number of ambulance paramedics on the road.
Daniel Andrews certainly hasn't been short for health announcements this year. The major funding winners include the Box Hill and Bendigo hospitals, as well as a cancer centre at the Austin Hospital, making the government in some quarters very popular indeed.
I love you. I honestly love you.
The issue of health has heated up this week, with either a Labor or Coalition promise nearly every day. The Coalition's major pledge is for 800 new beds and a 12-year plan, while the government's announced a $1.5 billion package to boost doctor and nurse numbers.
It's fully costed, fully funded. It is all about putting patients first.
Let's keep putting patients first.
It's fully costed, fully funded, but as fully costed and funded plans.
More staff, it needs greater transparency, it needs better systems. This is fully funded, budgeted and accounted for. We fully funded and budgeted and accounted. More staff, better systems, greater transparency.
But not all messages can be controlled with headlines like this. Freedom of Information figures show more than 200,000 Victorians are on hospital outpatient waiting lists, far more than on the official elective surgery lists.
We think those waiting lists before the waiting list should be public.
The waiting list today is substantially lower than it was in 1999, despite the fact that Victoria has grown, Victoria is ageing.
As for Echuca, they're still waiting. They have a plan to develop the hospital, but neither side has committed enough money to make it happen.
There are clearly areas where we can improve at the Echuca Hospital. That's exactly why the government allocated earlier this year $14 million to support both improved facilities in the emergency department and additional beds and community rehab space.
I have to say the Echuca Hospital and a number of other country hospitals have got very strong cases. There's no question that renewal is needed.
Echuca Health declined an interview, but says it's pleased with the progress being made by the Department of Health.
I think management are in a difficult position. Obviously they're quite keen for funding and redevelopment, as everybody in the community is. By the same token, they may be nervous about upsetting those that are going to provide the funding.